Vanakkam, Namaste and welcome to Dr. Shah's Clinic. On yet another video on erectile dysfunction, we are going to answer the question, what does erectile dysfunction feel like? The definition of erectile dysfunction is that if a man is unable to achieve an erection or is unable to sustain his achieved erection to the extent that sexual intercourse is not possible, then the patient is said to be diagnosed with a condition called erectile dysfunction. Remember, erectile dysfunction should be seen or noted in at least more than 50% of attempts at sexual intercourse. So, if an individual has erectile dysfunction 1 or 2 times or a couple of times, say out of 50 attempts, a couple of attempts, 4-5 attempts are resulted in a failure, it does not mean the individual is strictly suffering from erectile dysfunction. Those kind of failures can happen to anyone. So, these are more situational in nature. So, for example, some healthy men who have good erection will, they may not be able to get adequate erection at the time of, the ovulation window. So, sometimes healthy men will be trying for a child. The gynecologist will ask them to try during the ovulation window, the days during which the egg release is to be expected. So, between the 10th day or the 12th day or between the 10th day or the 14th day, whatever, depending on the woman's menstrual cycle. And in those instances, the male may not be able to get a proper erection or may not get erection that's of sufficient rigidity. But that does not mean the patient has strictly erectile dysfunction. It's more situational erection disorder. So that's what you have to bear in mind. What does an erectile dysfunction feel like? Like I said, if the rigidity is inadequate, or if the erection is not lasting enough, or if the erection is not at all coming at all, that's when we diagnose the individual with erectile dysfunction, and it should be noted in a large proportion of attempts. Point number 2. Most importantly, what basically happens is, as far as erectile dysfunction is concerned, it's not something you really want on your medical diagnosis, on your medical chart, because erectile dysfunction severely impairs the quality of life in a relationship. Not just that, erectile dysfunction affects all men at least once in their lifetime, but it's more common among men who are in advanced age. So with increasing age, the prevalence of erectile dysfunction definitely increases. So roughly 40% of men, or maybe 35% of men over 40 years of age will have at least one incidence of erectile dysfunction. So that's something you must bear in mind. And the disease erectile dysfunction is a public health problem today and affects close to 150 million people worldwide. And the number of men who are going to be affected by ED is also going to double by the year 2025. So it's definitely a problem that should not be ignored, because men feel less men when they're diagnosed with ED. It creates psychological problems, physiological problems, depression, anxiety, a sense of worry comes in, self-esteem is gone, the sexual interest is gone, the libido is gone, a lot of things, a lot of factors. So erectile dysfunction is not something that you should ignore. Not that it just does not affect the man, it also affects the woman. So if the male partner is diagnosed with erectile dysfunction, the female partner is going to feel a decreased sense of arousal. She's going to have decreased mood, decreased interest, decreased ability to hit orgasm, a sense of hopelessness comes in, doubts on the relationships creep in. So erectile dysfunction is a disease that destroys families, stable families. So it's something which all men should take active treatment for. So common causes of erectile dysfunction are usually diabetes, hypertension, along with hyperlipidemia, metabolic syndrome, and then other problems with organ flow, vascular abnormalities. Not just that, other causes include elevated prolactin levels in the bloodstream, decreasing testosterone levels, and spinal cord injuries. And with advanced men, men age, you have problems in the, you can have dementia, and you can have Parkinson's disease, so you can have other Alzheimer's disease. They are also associated with erectile dysfunction, much older men. Erectile dysfunction is also a marker of overall cardiovascular health. So usually when a man is diagnosed with ED, and especially if he's above 40, that his BMI is on the higher side, he has more abdominal obesity, what basically happens is there's a very high risk of myocardial infarction or coronary artery disease, roughly from about 5 to 10 years within the diagnosis of erectile dysfunction. So erectile function is basically a marker of a man's overall general health status. So if there's a problem there, then there's something going wrong in the man's body. It has to be evaluated and treated properly. So what does erectile dysfunction feel like? It doesn't feel very good, for sure. It severely affects the man's performance. It leads to performance anxiety issues. It strains the relationship. It destroys marriages, destroys healthy, stable relationship. And it's something that has to be actively treated at the earliest. I hope you enjoyed this video. Please like, comment, and subscribe. Please share this video with all your friends and loved ones. I'll be coming back with many more videos on erectile dysfunction. And this is Dr. Shah. Vanakkam.